Get started. Dr. Bridges, you're going to be speaking first. Is that correct?
Yes.
All right. So thank you all for hopping on today, our Lunch and Learn meeting. We appreciate you all. We know that some of you will watch this later on our YouTube channel. And I know that some of you all are hopping on as we get started. So we appreciate you all taking the time to do so. I'm going to go ahead and introduce our first speaker of our presentation today, and that is Dr. Catherine Bridges. She is a graduate of the University of Florida College of Dentistry and has provided dental care for patients of all ages for over 30 years. While in her residency, she trained under Dr. Garvey for hospital dentistry, and after graduation, she provided general dentistry in a private practice setting and in the hospital. In 2001, Dr. Bridges became the dental director for the Florida Department of Health in Marion County, where she continued to see patients of all ages, including those with intellectual and developmental disabilities and other special health care needs. She currently serves as the state dental director for the Florida Department of Health. And Dr. Bridges, with that, I'll let you take this away. I'll go ahead and real quick, I'll make you the host so you can share your screen and whatever you need to do, okay?
Okay. I don't need to share my screen though.
Okay.
It's okay. All right. Super. Thank you, Dustin, and welcome everybody who's on the call. And thank you for letting us speak. As Dustin mentioned, I'm with the Florida Department of Health.
Sure.
And for those of you who don't know, the Florida Department of Health has a network of county health department programs in all 67 counties. There are school-based preventive services provided in 55 of those 67 counties through the county health departments. The federally qualified health centers also provide services in some of those counties as well. The only two counties that don't have anything in the schools right now are Indian River and St. Johns counties, and that's due to some extenuating circumstances. We also have 31 county health departments that have brick and mortar locations for dental clinics in their counties. Some of the counties have more than one location, and the age ranges vary based on the county health department, and most of them at least see children. Others see adults and children. They should all be able to see some patients with intellectual and developmental disabilities or special health care needs, but it might be limited to either children or children and adults, depending on the county health department. I do have and I can put it in the chat in a minute when I get done speaking. There is a link that is on our public facing website. If you go to floridahealth.gov and you look on community programs, I can give you the link there, but you can actually search throughout the whole states. One of the things that our program keeps up with is we have a website that shows where dental providers for low income folks and those on Medicaid and all can get services. And that's for all the providers that report to us. So I will show that in the chat later on. Another initiative that we have through our state health office up here at the Florida Department of Health is back in April of 2021, we started what we call the IDD Roundtable. It's a group of about 55 community partners, including nearly all of our agencies that work with patients in general with any sort of disabilities, whether it's Florida Disability Rights or Medicaid or the managed care office programs, or the various agencies that work directly with those with IDD. And we all meet monthly, and we have been collaborating now for a while, working on increasing some of the main needs. Again, there's lots of needs that we come up with, but some of the needs are increasing the dental provider education piece so that dentists, dental hygienists, assistants, people can feel comfortable taking care of patients that have these special needs. Sometimes it's behavioral, and there's sometimes a struggle there to how to take care of this patient so that they're safe and the staff are safe and the patient is comfortable and gets the treatment needed. So that's one of the issues that we're working on, is increasing provider education, both in the dental schools, residencies, and also in those that are already graduated. Increasing the access to care, both in private offices such as dental offices, dental clinics, and also our ambulatory surgical centers and hospitals. And some of our groups are actually doing small clinical new models right now that they're working on in their regions. And so there'll be more things coming up with that. And that's some of the benefit of collaborating at a state level to try to increase that information. And we have at times through the round table, we've got certain patients like, okay, we can't find a location for this person, but we're all meeting together, so we can send that information sometimes out to help get them care in a particular region, so they're not having to travel so much. There's also Florida Community Care that is starting a pilot program through the Medicaid office. It's primarily long-term care facility treatment. However, and that is in Hardee's, Highlands, Hillsborough, Miami-Dade, and Polk counties. And they don't have a huge dental component right now, but because they're focusing on the long-term care, but they are able to pay for for people in that area that are in their facilities for dental care through like the emergency room or if they have a problem while they're there. Some of the other initiatives that we have are the state health improvement plan. So one of my efforts, and when I came up here to state health office, having been at the Marion County at the local level, providing care for so many years, is to try to get oral health on the map. Basically, there's a huge disconnect with providers in general that the mouth is somehow disconnected from the body. And so physicians don't necessarily look in the mouth, don't look for decay, don't look for gum disease, things like that. And dentists are not necessarily focusing on the systemic conditions that they might have. And so one of our jobs is to try to improve that education piece. And in the process of just getting some of that information out there, we were able to get oral health part of the state health improvement plan in a big way. So to increase access to care, lower emergency room visits, which helps us all, keeps people out of pain, and also lowers our taxes, and increase preventive services. The more preventive care we can get, the less trouble we're going to get into. We also are working on some oral education to share links with people on the oral health connection with overall health so that people do realize that the mouth is actually connected to the body and is very important in keeping overall health care. As far as the training piece, we're working on the oral education, we're going to have a statewide oral health education campaign through public service announcements coming up in the hopefully near future. We're working with the Department of Health Communications Office to create those, and then actually working with a nonprofit to get that information out. And those will focus on resources about oral care, diabetes prevention, cardiovascular disease, nicotine cessation, and other healthcare needs. So pretty much we'll have these little public service announcements, and then it's going to link back to a page on our website, which will give you lots of links to where you can get care, get information about it, how to see about getting something in your area, whether it's diabetes prevention or something about health plus with cardiovascular disease, or something on getting nicotine cessation, whether it's smoking or vaping, some of those conditions, as well as oral health and getting your teeth fixed. Another area we're working on with training is for our providers is through our federal grant, our HRSA federal grant. There's two different trainings going on. One is a training for oral health education for our medical and dental providers to reconnect the mouth to the body and get dentists and medical and physicians and nurses and all on the same page on how to prevent, and also seeing all the linkages there are, whether it's increase in heart attacks, strokes, increase in diabetes. There's a huge correlation, for example, between diabetes and oral health. So looking at some of those things and trying to improve the educations of providers. We're also really excited to offer a training coming up with the University of Florida College of Dentistry. Dr. Garvey and his team will be providing trainings in various regions throughout the state through the University of Florida College of Dentistry on training providers and dental students on how to take care of patients with intellectual and developmental disabilities and other special healthcare needs. Looking at those how to keep a patient safe, how to, looking at the behaviors, how to triage properly, what a provider can realistically do in their office with some training versus what, they really are. The patient is too medically compromised and needs, for example, hospital dentistry. So they will be doing that training starting in the spring, and we're very, very excited about that. And that's pretty much all I wanted to cover at this point. If you have questions, I'm certainly happy to answer questions on my section, and otherwise, I will kick it over to Dr. Garvey and give his introduction. Dustin, were there any comments or anything in the chat?
No, ma'am, not yet.
Not yet. Okay. All right. So I'm going to move on with Dr. Garvey then. Dr. Garvey attended the University of Florida College of Dentistry from 1976 to 1980. He and I were overlapping a little bit. I started dental school in 84 and graduated in 88, and then did my residency from 88 to 89. So subsequent to him graduating from University of Florida College of Dentistry, he completed a hospital-based general practice dental residency in Utica, New York. He had a dental practice in Seminole, Florida, and he's been teaching at the University of Florida College of Dentistry since 1989. So very good little while there. He's also on staff at Shands Hospital at UF. His practice is focused primarily on providing care for adults who have disabling conditions. For many years, he was the director of a dental program that cared for people with developmental disabilities who resided at a government-managed state of Florida community. Subsequent to that, he opened a second clinic for people who had developmental disabilities who lived elsewhere. The collaborative efforts of working with professionals at UF Health, Shands Hospital, and the University of Florida College of Dentistry have resulted in many, many patients receiving much needed dental care, but who found it challenging or impossible to receive that care. His desire is for dental students to become acclimated to provide care for people with disabilities. And again, I've worked with Dr. Garvey a number of years. He's on our IDD roundtable. And of course, he's helping leading the discussions for the UF training. And I'm super excited to welcome Dr. Garvey.
Wow. Thank you, Dr. Bridges.
Sure.
I have been asked to make this as quick as possible, but I'm trying to cover what I think are the important points here. And I would hope that anybody who has any comments, questions, would interject with them however you can, either on the chat link there or verbally or whatever. So I think, is it Ms. Gaspard who has the controlling of the Zoom meeting here, or the PowerPoint rather?
Can everyone see the screen?
Yes.
If you could click slideshow on the top,
Yeah.
on the taskbar.
Can you see, but are you seeing like the feed of the images to the left and then not presenting? Like what do you guys see, the full screen or?
Yes, ma'am. We see the exactly what you see. We're seeing the screen to the left with all the other slides, and then we see also the main slide.
But if you would, yeah, if you could click slideshow, or on the top, on the, see where it says slideshow?
Yeah, there you go.
Yeah, I do. It's just I have two screens, so let me just move it over. 1 second.
Mm-hmm.
There you go. Okay. All right. And I'm going to try to be succinct here. These are just some pictures of different places where you can provide dental care. The top left is me taking care of a patient many, many years ago, who's disabled, by the way. This is how we used to dress pre-COVID. And he's disabled. He has a developmental disability, an intellectual disability, but we were treating him exactly like we would treat anybody else. That's our goal, is to treat patients with the same standard of care as anybody else. And most people with disabilities can be treated without special accommodations. The right-hand picture on the top is us taking care of a person in a wheelchair. We opted to just keep the person in the wheelchair, which if you look at it, it has the same inclination as the dental chair on the left, which you can do if you want, or you can transfer people. The bottom left picture is me taking care of a person in a hospital operating room. That's my favorite place to work. It's a very strange place for dentists to work, but you can get things done that you can't get done anywhere else. It's a major process to do that, but it's a life-saving thing. The bottom right is a picture I stole off the internet. That's New York University's clinic for special patients. So you can accommodate to whatever the people need in whatever way you have to, if you have the support to do so. Can you click the next slide? Okay, this is just some demographics as to the kind of disabilities that people present with, whether you're non-ambulatory on the top left or you have cognitive issues. The bottom left picture is somebody who's hearing impaired and you need sign language. And the bottom right is somebody who maybe has ambulatory problems or is visually impaired. But again, you just kind of work around whatever they present with. The main impediments to getting care, I put them on here. People can have medical problems that make it challenging to provide care in a regular dental office. But if you communicate well with the other healthcare providers, physicians, nurses, and pharmacists and all that, you can usually manage it. Behavioral is the biggest issue that we deal with. Most of our patients can't sit in a chair and won't talk and they won't cooperate. And how do you deal with that? Well, whether it's just working around their behaviors of getting them comfortable with you or giving them other things like medications to calm them down, you can get it done. Financial is a big impediment to people, whether you're disabled or not. So we basically aren't here to sell anything. We just present the treatment options out there and the caregivers decide which way they want to go. I pulled this off of a document that I received. I think it came from the Agency for Healthcare Administration, that in Duval County, which is Jacksonville, in a 1-year period of time, apparently this amount of money was spent in hospital emergency rooms for dental problems. Many of my patients don't have dentists, and when they're in distress and in trouble, they rely on hospital emergency rooms for dental care, which hospitals don't provide dental care. They basically give you an antibiotic and tell you you better go find a dentist. So it's not the way to go, and it's very costly, as you can see there. Okay, this is not all inclusive, but it's a list of many disabilities, and we all dental people take care of people with all these issues. With a little bit of help, you can work around all of these. I did highlight the two that are in bold print there, autism and developmental delay, because those are the primary things that my patients present with. But I've taken care of all of these, and a lot of dentists can take care of all of these if you have a little bit of help and support and somebody can kind of show you how to do it. Go ahead and go to the next one. Okay, this came from the American Dental Association. If you look at it, stated 4 years ago. The American Dental Association amended their Ethics Standard Practice Act that we cannot deny care to someone, and they added, this was how it was phrased beforehand, but they added the word disability to it. We can't deny care to someone because they have a disability. Now, it happens all the time, but we're not supposed to deny care to someone based on the fact that they are disabled. We're at least supposed to give it a try. Nobody's going to ask anybody to do thing that is dangerous or beyond my capability, but we're supposed to at least try. And we're trying to get that thought process out there among our colleagues now. Go to the next one, if you would. Dr. Stephen Perlman probably knows as much about this as anybody in the country. He's a pediatric dental specialist by training, but his knowledge of taking care of adults with disabilities is incomparable. But these are statements on the top from him that this is the biggest healthcare problem in the country. Now, he may be exaggerating, but I don't think he's too far off. He also is adamant that he doesn't think this should be a specialty in dentistry. Every dentist should take part in this in some way or shape or form. And most people with disabilities can be treated in a regular office. You don't need to go to a special place unless you have really unique special needs. The bottom statement there came from an organization in the state of Florida that, and we've heard this so many times, that my patient population usually can find a physician or a pharmacist or a nurse or an OT or a PT, but finding a dentist is the hardest thing to do. So we're trying to make that better. Go ahead to the next one, if you would. So sometimes just Dr. Bridges mentioned what we would really love to do is to try to implement preventive care. That's what we want to work ourselves out of a job. So starting at step number 1, trying to keep people's mouths healthy. A lot of it depends on what the patient can do, or do they need help to implement things like brushing and all that. And sometimes you can be creative and come up with a different way of getting things done, such as brushing. If you can go to the next slide, there's a picture on there, or pictures on there rather, that shows sort of a diagrammatic representation of alternate ways of getting it done. These are on the left and on the right, two different kinds of brushes that are made for people that either have difficulties handling a toothbrush themselves with maybe a tremor or something like that, or people that don't like a brush in their mouth. Many of my patients really don't like a toothbrush in their mouth, period. End of statement. But to get it done is a necessary thing. And these are ways of getting it done without bothering the patient as badly, or you can get it done if you try to do it yourself without having to use so much effort. The one on the left is a little bit nicer from my point of view than the one on the right, although they both work. If you notice the picture in the middle, the brush covers the outside, the inside, and the top of the tooth all at one time. It's not a cure-all. I attended a Zoom meeting a couple months ago. One of the presenters was in a different healthcare field. I think she was an OT or a PT, which are admirable jobs. But she made a comment that I took a little exception to at the time because it sounds good, but it doesn't always work. Her statement was something along the lines of, the standard of care for our patients is to use an automatic brush. But she made that as a statement of fact, whereas I've found that for my patient population, especially if you have autism and sensory deficit or sensory processing issues, automatic brushes are not always the answer because they're bigger and they move and they make noise. And many of my patients are very turned off with those types of things. So I would say if an automatic brush works, go for it. I don't care what you use. But if it doesn't work, don't rely on it as the only out because there are other ways, such as what I show in these pictures here. Sometimes the basic stuff is really critical. These are x-rays that I took on a patient of mine. I took care of this woman for 30 years. She was in her mid-60s when these pictures were taken. Now, I wouldn't expect you to understand how to read x-rays, but these two pictures show the same part of her mouth. The picture on the left I took in the hospital. She's very difficult to work on. The left picture is her bottom left back teeth. The bottom left back teeth. One of them is her wisdom tooth and the other is her 12-year molar. For somebody in their mid-60s with a profound disability, that's fantastic, wonderful looking. A week later, and I admire the caregivers of my patients. The caregivers at the facility where she lived noticed one day, a week after I took this picture on the left, I hospitalized her to do her dental work. That's where I got the picture on the left. A week later, she was home and her caregiver realized she's not acting normally this morning. She's not eating breakfast. I wonder why. And so they brought her over to our clinic. I was able, with a lot of managing, to get that picture on the right-hand side. I don't know what happened. Her caregivers don't know what happened, but this is the same part of the same mouth on a lady who's in her mid-60s, who's nonverbal with profound intellectual disability. She had a severely broken jaw. Nobody knew how it happened. But this lady, the patient, couldn't talk. If it hadn't been for her caregiver noticing, she just doesn't look good today, we would not have known that she had a broken jaw and some seriously bad things could have happened. We got this fixed. I don't fix these, by the way, but I know who does. And they fixed her broken jaw and she's doing fine now. So again, it's a team effort. It's a very collaborative thing. This is a picture of a lady I took care of 2 years ago. She lives in Marion County, Florida. She was about the same age, probably mid-60s. She had been on a feeding tube for years. And this is a very classic image of somebody who's on a feeding tube. My feeding tube patients are usually on them because they tend to aspirate food. The food that they try to swallow goes into their lung instead of into their stomach. So the feeding tube makes it less problematic. But this is what their mouth ends up looking like. So she came in and I looked in her mouth and I thought, oh my goodness. And she couldn't tolerate the care in an office. So this picture was taken in the hospital operating room before I started working on her. She was unconscious at the time, but this is what her mouth looked like. That is hard as a rock. That won't come off without a tremendous amount of effort. But anyway, we cleaned her up. Go to the next picture. That's what she looked like when we got done with her. She had the prettiest looking teeth on the planet Earth. But again, the only way this could get done was in a hospital operating room. So this is where you go to the extreme degree to get things done, but it worked out really, really nicely in her way, in her case. This is a picture of a young man, going back to Dr. Bridges' comment about prevention. This is a young man who's in his mid-20s, and I had to hospitalize him. He's lying in the hospital operating room on a table when I took this picture. He's about 24 years old. He has autism, and so you have these structured lifestyle type of things in autistic with people with autism. This is what his mouth looked like. He had been living with this for years. In one appointment, I took out a lot of teeth and I filled a lot of teeth. But he had been living this way for years because he couldn't find anywhere to go. But when we got done, his caregiver told me that he drank 18 cans of Dr. Pepper every day. Dr. Pepper and all those types of sodas are full of sugar. This is what it does to you. So anyway, prevention can come in a lot of different forms, not only brushing, but what are we putting in our mouths? So try to handle the lifestyles. This is like the worst case scenario. Every dental student nowadays sees this picture and knows of this young man. 17 years ago, he lived in Baltimore area, and he wasn't disabled, by the way, but he was on Medicaid. And with people on Medicaid, it's very challenging sometimes to find a provider. So they had a hard time finding a provider for this young man to take care of his bad tooth. I've never had this happen. I hope I never have this happen, but his bad tooth caused a brain infection, which caused him to die. He died from a bad tooth because they couldn't find a place to get it taken care of. Most of my patients end up in a lot of pain for a long time, but I don't know of a fatality that's ever happened, but it could happen. And so what we're trying to do is to prevent things of all kinds of bad nature from happening. Okay, now, how do you manage behaviors? This is one way. This is a little kid who's getting laughing gas. That is the least invasive way of handling medications to control behaviors. It works with some people. It doesn't work with others. But every dentist at least knows how to use it. Not every dentist has it, but every dentist knows how to use it. And it's your own choice if you opt to give it a try. It works sometimes. Go to the next slide, if you would. This is the other end of the spectrum. Now, parents, caregivers frequently use the word sedation when they talk to me. And for me, sedation is a hard word to define because it means many things to many people. The thing I showed you in the last picture is a type of sedation with laughing gas. This is the end of the spectrum. This is not sedation. This is a patient given 5 different drugs to render them unconscious on a table while they fix their teeth. This is what's called general anesthesia, but this is in a hospital operating room where we pretty much usually just fix the whole mouth in one appointment. It's an extreme radical way to go, but it's an incredible way to go. It's hard to make all the details kind of fall into place, but if you can get them to fall into place, you can get things done that you can't get done anywhere else and really improve the patient's quality of life. Go to the next one, if you would. Okay, some of the kind of things we see. I got these pictures in here because it's just I can demonstrate something graphically here. These are people who have had facial trauma. I have patients that have seizure disorder, they have cerebral palsy, and they have a hard time walking without falling, or maybe they were in a traffic accident. Anything could happen, fall off a bicycle, you name it. But the picture on the left-hand side shows teeth that are in the right place. But if you look at the one in the middle, the tooth in the middle there, it's darker than the ones on either side. That means there's something internally that's gone wrong with that tooth. The picture on the right-hand side shows a similar thing. The tooth in the middle is even darker, but up on top of it, there's what looks like a pimple. Both of those teeth are abscessed. The teeth are fine as far as not having been broken, but the damage from bumping into that tooth when you fell or something happened to the traumatic event happened, what it did was it caused the nerve to die, and it's infected and it can hurt really bad, and we need to take care of those. These I can tell visually there's a problem. Sometimes you can only tell by taking an x-ray. Go to the next slide, if you would. This is an x-ray of somebody who had facial trauma. on a bottom front tooth. The tooth looks fine to the people staring in your mouth from outside, but if you look at that middle tooth, there's a big round halo around it. That is a really nasty abscess that happened when that person fell and bumped that tooth. We can fix this, but you need to know that it's there to fix it. And sometimes taking an x-ray is the only way you can do it. I'll do anything to get x-rays on my patients. Here is I've got a lot of case presentations here, and I'm going to try to go through these in a hurry. This is a gentleman that I took care of, about 7 or 8 years ago. He was a 47-year-old man with autism, lived in a group home in Orlando. And I got a phone call from someone that was really concerned about him. He can't talk, but from what I gather, I kind of pieced the puzzle together. Somehow he presented with a swollen face one day. They didn't know what had happened, but he had a swollen face one day. Well, they took him to a hospital operating room or whatever, hospital emergency room rather, excuse me. And they have this x-ray picture here. He was good enough to take an x-ray. I don't expect you to understand dental pathology, but this you don't need to be a dentist to understand. If you look at the left-hand side of this picture, you can see a tooth on the far left-hand side kind of turned upside down. That is a wisdom tooth. Wisdom teeth tend to do weird things. This wisdom tooth is kind of going in the wrong direction, which happens, by the way. But one of the things about wisdom teeth that haven't come into your mouth, and that tooth can't come into his mouth because it's going the wrong direction, is that you're more likely to have a tumor or some sort of a growth occur around it. Well, that man has a massive tumor around his wisdom tooth. That's what that huge gray circle is underneath it. There's a big tumor in his jaw. Now, if you look at the top, go back if you would. If you go back to the top of that picture, around the root of that tooth, you can see a horizontal gray line. He also has a broken jaw. He has a tumor and a broken jaw. He went to the hospital. They sent him home saying, we don't do that. And he walked around. He can't verbally talk. He walked around Orlando for over a month with a broken jaw and a tumor, and nobody would touch him. Well, he finally got referred to us. Our oral surgeons fixed this, and he's okay now. But the fact that he had to walk around Orlando for a month with a broken jaw was very problematic and troublesome to me. Okay, move on, if you would, please. Okay, just some other quick case histories. Here's a person I took care of in a hospital operating room, which in those places you can do weird things, crazy things. In one appointment, I filled 7 teeth. I took out 22 teeth in one appointment. That's the only way the person could get work done because it had been many years. Go to the next one, if you would. Here's a young lady that lived in Daytona Beach. I loved working with her. She was disabled from birth with many health issues, many health issues. But bottom line was she weighed 30 pounds and she was a 26-year-old woman and couldn't find a dentist. And she had bad teeth. Mom told me she lost 6 pounds because her mouth hurt so badly. We brought her up here. We fixed her up. And she was a very charming person to work with. I loved working with her. But her medical problems were pretty involved and serious. But we found a way to take care of her. Go to the next slide, if you would. Go to the next one, too. I'm going to go through these in a hurry here. Okay, this is the kind of story that we hear a lot. And I took Mom at face value. She lived in Jacksonville, and her 26-year-old son did have many problems medically. But she told me she called 90 doctors and nobody would treat him. Well, we had a good staff that was able to do it. We brought him up and cleaned his teeth in one appointment. Okay, we had a staff that was able to manage it. But again, I felt bad for Mom. Okay, go to the next one, if you would. Financial is one of the impediments to care. This is a fellow that both had autism and he was hearing impaired. He lived in a place down in Mount Dora that was able to care for his needs. He came into our office one day. We cleaned his teeth up, and we didn't charge as much as people might in other places. So for basically $200 or $300, we kind of did an exam, cleaned his teeth up, and he looked really good. The mom told me that the last time he had anything done, his insurance didn't cover it, and she had to pay $3,000 out of pocket. Well, some people can't afford that. I felt sad that that's what the options were. Okay, go to the next one, if you would. Okay. This is one that was at the top of my list of sad things. St. Augustine, Florida, 33-year-old man. I knew a neighbor of his. The neighbor called me and said, this man's in sad shape. He's in bad shape. He lives at home and his mom's trying to help him out, but he has intellectual disability and he has bad teeth. Can you do something? I never met the man till he met us in the hospital one day. Mom told me, we were talking on the phone, she told me that it was waking up at night yelling because he hurt so bad. They took him to the emergency department, which did what they normally do. They gave him an antibiotic and said, you better go find a dentist. Well, go to the next slide. There's what I did. The first time I ever met the man, I took out 32 teeth. They were as bad can be. And the sad part is, I called his mom about a week or two later just to do a follow-up. How's he getting along? And she shocked me with her answer. She said, it's incredible. He's not waking up at night yelling anymore, and he's eating, and he's actually putting on weight. She was thrilled to death that her son has no teeth and will never have teeth again because he's finally out of pain. This is, for him, that was a success. So anyway, I liked that. This was another difficult one. A man was referred to us from Miami because he was profoundly disabled, wouldn't cooperate with anything. But if you look at the second line there, I've never treated anybody that big before. It took a big team effort in the hospital to take care of this very non-compliant 485-pound man. But we got him done in one appointment because we planned it and had people willing to go the extra mile with him. Okay, go to the next one if you would. Actually, go to the next one. I'm going to just kind of go through these in a hurry. And go to the next one. Go to the next one. Okay. This is it sounds kind of silly, but I just heard someone say this one time, and it made sense to me. People don't care how much you know until they know how much you care. You know, if you're willing to try, frequently the caregivers just really appreciate that you're willing to try. And sometimes you can have success that you didn't think you would have. Go to the next one. I would hope that our colleagues would not be afraid to at least give it an effort. That's all we would ask for. Okay. Comments, questions? I'd be happy to field them if we could.
Unless anybody wants to interject, we don't have anything in the chat yet. I think we're ready to move on.
Thank you, Dr. Garvey. It is heartbreaking to see some of these patients, and we're all passionate about getting care for patients like this. So again, the more preventive care we can do, and then getting them seen, and it's so important to have them, as a caregiver or a family member, to be looking at your patient, your family member, your person you're taking care of, because there can be those subtle changes that you really need to clue in on it. So I appreciate that. Our next speaker is Whitney Haley. She is a dental hygienist. She's worked for the the Florida University of Florida College of Dentistry. I get all my Florida blah, blah, blahs mixed up. University of Florida College of Dentistry in the Department of Community Dentistry and Behavioral Science at the satellite campus down in Seminole, Florida for the last 10 years. Her position allows her to work closely with a nonprofit organization called Special Day Foundation. This organization provides financial assistance to patients with developmental disabilities at the University of Florida Dental Clinic in Seminole. This unique program is not only a resource for dental treatment at the clinic, but it also allows Whitney to provide educational dental screenings off-site at group homes and adult day programs. Whitney educates patients and caregivers in the proper dental hygiene care at home, as well as helps desensitize participants for their dental care at the clinic. And that's very important. If we can just take a little time to get them used to it, a lot of times they're quite cooperative in the clinic. She acts as a resource source to help fill in the gap for the community in need and an educational program with capabilities. When not working, you'll find Whitney praising Jesus, sounds good to me too, working out at her local CrossFit gym, or traveling the world with her husband and daughter. And now I'm going to turn it over to Whitney. Thank you, Whitney.
Thank you so much. Excuse me, everyone. I have my daughter today. She's sick, so she's home with me. But yes, as mentioned, I work for a wonderful nonprofit, or alongside, I should say, a wonderful nonprofit called the Special Day Foundation, and they provide funding to the clinic, and we'll get into that a little bit more. I do have a screen to share.
Perfect. Then I can I'll help you out with that.
Okay. Do I need to request sharing?
Oh, you can. Yeah, if you request it, I can accept it. Yes, ma'am.
Okay.
And while you're doing that, Amy had a question. She said in Bay County, Panama City, we have issues finding a provider who will sedate. I work with people with disabilities, and often they will not sit for dental exam, etc. Any insight on help in this area?
Where does she live?
Bay County, Panama City.
Oh, Panama City. Oh. I think Dr. Bridges knows a person that does dental anesthesiology over there, does she not?
Sure. So the Bay County Health Department is there. And then if they need sedation in an ambulatory surgical center, they're healthy enough to get at a surgery center, then the PanCare, and I can, if you want to contact me, I'm happy to give you more information. But PanCare has a Panama surgery center up there, so we can certainly get you information about that. But a lot of it can be desensitization. I have seen patients in the corner of a front room office. You know, there's a lot of places you can do treatment instead of just the necessary dental chair. So please just get a hold of me. I'll put my name information in the chat.
Thank you, Dr. Bridges, for answering that. Amy, hopefully you got that. Dr. Bridges will put her information down for you.
You want me to continue?
Yes, ma'am. You can go ahead.
Okay, is my screen is being shared, okay?
Yes.
Okay, great. So I'm specifically going to be talking about the special day program today and how it works, if you will, at our 3 satellite dental programs. So satellite meaning we still fall under the University of Florida. Well, am I still sharing?
Yes, ma'am. I can see it.
Okay. We all still work under the University of Florida College of Dentistry, but they have satellite dental residency programs in Naples, Hialeah, and St. Pete. These programs, or all 3 residencies, offer postgraduate education for licensed dentists. So all the dentists working at the program, again, are licensed. But they're seeking to expand their education in specialty dental practices such as orthodontics, periodontics, endodontics, prosthodontics, sedation dentistry, and special needs dentistry. So I personally work at the St. Pete Clinic in Pinellas County. The Special Day Foundation. All 3 resident programs, that's enough, are very involved with treating special needs patients. Thankfully, the College of Dentistry has partnered with a nonprofit organization called the Special Day Foundation that leads the way in this initiative. The Special Day Foundation makes it possible for hundreds of patients with developmental disabilities to be seen inside our dental clinics, as well as off-site in their homes and day programs. This program helps fill the gap for those that are underinsured or not insured at all. So each fiscal year, new patients are enrolled into the programs to receive financial assistance for dental treatments for a 12-month period. So the fiscal year runs from July 1st to June 30th of each year. These treatments encompass orthodontics, fillings, extractions, root canals, crowns, cleanings, and much more.
Whitney.
Are we still?
Yes.
Are we just looking at this first slide still?
We're in the second slide.
Okay,
Oh,
maybe
so
it's
we're
not
losing.
on the.
My screen sharing is paused. Resume. Try now. It should be like a
There you go.
fishing.
There you go.
Okay. Sorry. So, so in addition to the dental programs, the Special Day Foundation also has a fishing program. The captain is Captain Mark. He takes a group of 5 to 6 people out fishing for the day. A fishing license and fishing gear and water are provided, and the fishing day is completely free. The only stipulation is that one person in the group must have a developmental disability. And keep in mind that the charter is based out of Bradenton Beach. So you also have to be able to get to Bradenton Beach. I'll talk more about the dental program next, but more info on both the fishing and dental programs along with applications can be found on the Special Day Foundation website, which the link is, I know you can't click on it, but if you want to just write that down, you can Google search the Special Day Foundation, and just making sure that you're clicking on a website that has this our looking logo here. The 3 locations offering the Special Day Foundation are again in St. Pete, Hialeah, and Naples. If you notice here, I just broke down what each clinic is providing because there are some similarities, but there's also some differences. So in the St. Pete clinic, we do offer sedation on site for oral and IV. And then we are in the process of getting privileges at a local hospital. So we will be doing general anesthesia soon as well. Hialeah does all the specialty practices as well, but they don't have sedation options. And then Naples is a pediatric clinic only. They also have a really cool sensory room. It's great for helping to desensitize kiddos before they come in for their dental visits. They do have free IV sedation and free general anesthesia. We are able to intermix the program. So let's say you live in Hialeah and your loved one needs sedation. As long as you can get to the St. Pete clinic, we can see you. But just keep in mind that the Special Day Foundation funding, the financial help, can only be utilized in these 3 clinics. And then here are the other Special Day Foundation hygienists. So Mary Ellis is on the top slot, is on the top picture. Allie is in the middle on the bottom picture. And then this is on the right side is the 3 of us at the Center for Autism Related Disabilities annual conference in Orlando. The Special Day Foundation program participants also have the option of receiving off-site visits. These visits consist of me traveling to them off-site at either their group home, day programs, or private residences with proper supervision. My visits consist of a basic toothbrush cleaning, flossing, and a fluoride treatment. In addition to this, I provide helpful at-home care tools to meet the needs in order that they or the caretaker may obtain better results when completing oral hygiene routines at home. These visits consist of a lot of repetition as well as encouraging education. This in turn helps with desensitizing those that may be nervous about going to the dental office. By routinely seeing me in my dental PPE, looking in their mouth, brushing teeth, and building a rapport, I have seen patients that originally could not be seen without sedation, eventually being able to sit in a dental chair, receive an exam, cleaning, and x-rays. Some have eventually been able to tolerate even more extensive treatment, such as fillings and extractions. It's quite amazing to see when this happens. Each participant also receives an electric toothbrush and refill toothbrush heads during the program. Amana, baby, it's too loud. She's doing her ABCs. Each participant also receives an electric toothbrush and refill toothbrush heads during the program, along with a wide array of other tools that help make hygiene at home easier. We do provide water picks for those that might be in ortho, specialty manual toothbrushes. Those were touched upon with Dr. Garvey. He showed you the Collis Curve and the surround toothbrushes. And then I also provide with different flossing tools. Nobody likes to floss, but it's necessary. There are other options out there other than just using regular string floss. And we help provide and guide people to what tools would work best at home. My visits also help build relationships with caretakers in group homes. This allows me to help instill the importance of dental hygiene in their homes and educate caretakers on the why we need to do these things like brush and floss, and also help explain why routine, excuse me, no ma'am, you need to wait till mommy's done. Help explain why routine dental hygiene care is just as important as routine medical care. I have conducted trainings for group home staff and tailor the education to the needs of the group home. I also put together a newsletter 2 times a year, so biannually. If you'd like to stay connected with the Special Day Foundation, feel free to follow their Facebook pages. We have 2 different pages. One is just a general Special Day Foundation page that I manage. I provide educational info on there. And then Allie, the Special Day hygienist in Naples, manages the Special Day Foundation Naples Facebook page, and she posts a lot of pictures from the sensory room. Let's see. In addition to the Facebook pages, I also put together a newsletter twice a year. The newsletter provides updates from each clinic, encompasses an educational component, and highlights a Special Day Foundation participant from one of the 3 programs. The newsletter is released January 1st and July 1st every year, and you can get on the email list by messaging us on Facebook or by going to our website and filling out the contact form requesting to be added. These are insurances that are for the St. Pete Clinic specifically. I don't have a lot of knowledge on insurance, but these are the Medicare plans that we accept at the Seminole Clinic. So no matter, I'm always accepting applications for the Special Day program, even though the fiscal year runs from July 1st to June 30th of each year. That's just when the financial aid is acting upon the behalf of somebody who needs help. But I do accept applications all year long. And so apart from Medicare plans or any other insurance plans that we might accept outside of Medicare, basically the Special Day Foundation acts as like a gap coverage is how I like to explain it. So we utilize the insurance first, and then whatever insurance might not cover, the Special Day Foundation will try to step in and cover as much as finances allow for that year. Also keep in mind that in order for our office to complete dental treatment in the hospital setting under general anesthesia, the individual cannot have Medicare AB, as this particular plan considers dental an elective procedure and will not pay for the room, board, and anesthesia. That's all I have. So I can stop sharing, and if there's any questions about the program, feel free to ask.
We did have earlier, and somebody responded to that. Lisa Schaffner said, "I wish we had more dentists like you, Dr. Garvey. Unfortunately, with Medicaid patients, we can't find any dentists in Central Florida who will take Medicaid insurance, and there is a long list for getting care at Shands. We really have to work on getting better funding for dentists, as many of them state that Medicaid fails to pay them Medicaid fails to pay them on time or not enough." But other than that, I don't see anything else in the chat yet. If anybody has any questions, we have a few minutes left in our meeting. If you want to go ahead and unmute and ask your question, or if you want to type it in the chat, or if you do want to contact them later, hopefully you saw their information, or they can put it in the chat. We're also going to be sending out information from the meeting today in a follow-up email later on this afternoon. Well,
If you can, this is Kristen Snyder with Liberty. If you don't mind, with some of the questions that are in the chat, if you can give them my email address, I'm happy to work with them on the concerns that they brought forth, because we do have some areas that we're working on, especially in Bay County. And if there is an access to service issue, we want to be a part of the solution and not a barrier. So if they're having problems with payment or funding, let's work collectively together to achieve the best outcome for the member.
Absolutely. Yeah, Kristen, if you don't mind, Kristen, you have the ability, you can go ahead and type your own email in the chat and everybody can see it. I would appreciate it. Thank you so much.
Yes.
Well, Dr. Garvey, Dr. Bridges, Stephanie, and Whitney, we appreciate you all so, so much for taking the time today to give us some vital information. The Arc of Florida, you all know we used to have the dental program. So over 2 years now, we haven't had it, and we still get phone calls with people really needing help and really needing services. So we know that dental is just a huge, the state of Florida has been really missing the mark with dental the past few years. With our population, and so we know that there are families and adults and children with intellectual or developmental disabilities that are just in dire need of some help with dental. So we know that just at least there's some of you out there that are working hard to do what's right by them, because like you mentioned before, Dr. Garvey, there are a lot of sad situations out there, and that's not what we want. So. All right. Well, thank you all so much. We'll end the meeting. Like I said, you can follow up. We'll have this whole meeting recorded on our YouTube channel later on, either today or tomorrow. We will send out a follow-up email with the agenda and any presentation or slide that was in the meeting today. So we appreciate you all. We hope you all have a Merry Christmas and you all have a great day.
Thank you.
Thank
Been
you.
Thank
fun.
you, Dustin.
Yay.
Very welcome.